When we use concentrated insulins, we have few advantages. One is you get less volume when you inject the insulin. When you have less volume in the soft tissue, the absorption gets better. So that's one. Number two, depending which concentrated we're talking about, I'll give one example for you. There's one insulin which is called Degludec. That's a basal insulin. It comes in U100 and U200. With the U100, you cannot inject more than 80 units at once using the pen. If patients are on 100 units a day, they need to inject it twice. But if they use the U200 Degludec, they can inject up to 160 units per one injection. So then less injections and better compliance. Third, when we use one concentrated insulin called U500, for example, that's when we switch patients from U100. Typically, these patients are on 4 shots a day of basal mealtime at a dose of more than 200 units per day. So again, compliance is a big factor here. When we switch them, we switch to 2 injections a day of U500. And with the U500 pen, they can dial up to 300 units per one injection. So not only the volume is smaller, the absorption is better, but compliance is much better. And patients also can save on copays. When they go from 2 different insulins to one insulin, like U500, it's 1 copay versus 2 copays.
It's a really exciting time in terms of diabetes. Never a good time to have diabetes, but it's a very exciting time in terms of the availability of newer insulins and the concentrations we have available. So we have U200 insulins, we have U300 insulins, and then we have, which is not new, U500 insulin. So let me talk first about U200 and U300. How is that different from U100 insulin? It's actually not. We call them concentrated insulins, but it's all about the volume. So if you're dosing a patient on a U200 or a U300 insulin, you're going to tell them that they take the same amount of insulin as a U100 insulin. The difference for the patient is the volume under the skin. So for instance, a U200 insulin is going to give you 50% of the volume, less volume under the skin than a U100 insulin, and U300 is going to give you 1/3 less under the skin than a U100. Now they don't act any different, it's just all about volume. So even though we call them concentrate, remember it's all about volume. U500 is in its own class. It's been around for a while. We use that for insulin-resistant patients. It's kind of funky how it works in a fun way because it's both basal and bolus. And yes, it is concentrated, but it's concentrated to give those patients who need larger doses of insulin, who are really insulin resistant, a nice insulin that covers them both in the basal mode and in the bolus mode.